Thank you, Governor, Secretary. Nice to see you. Glad our paths have crossed this morning. Just a couple of questions. First of all, I assume that you had a role to play in the President's budget, and I wanted to raise with you, or at least ask you to assure me that the cuts in the critical access hospital program you think are appropriate or necessary. The President's budget has a couple of proposals. One's a mileage restriction. Depending upon what that mile might turn out to be, it affects from a small number to a large number of critical access hospitals in Kansas, and then a reduction in the so-called 101% of costs to 100% of costs. And I think we would agree that the word cost doesn't cover the cost. And as you know, in our state, those critical access hospitals in many ways determine the future of a community. In the absence of their presence, no physicians and citizens reluctantly decide they no longer can call home home. So I wondered your thoughts on the reductions in spending related to critical access hospitals.
Well, Senator, you and I have talked about this in the past, and I do share your concerns about access to health care, particularly in rural areas, and know how important that is to community survival. I do think that you know, in a better budget time, this would not have been recommended, but think that the framework of a possible 10-mile differential, if there is another hospital within a 10-mile radius, then it is unlikely that that is a critical access hospital, because there is another choice in a relatively close space, and making sure that 100% of payment is paid. It isn't reduced below 100%. It is 100%. I think working on then the definition of what that cost means is a secondary issue, and I'd be glad to work with you on that. But paying 100%, I think, is very important.
Well, I would agree that if we actually paid 100% of actual costs, that's a different story than paying 101% of something less than costs, or paying 100% of something less than costs. And so the definition of what's actual costs needs attention, and the percentage would become much less important if actual costs were actually covered. I assume that the mileage change, if enacted, would be retroactive, would be current, and so hospitals that currently receive a critical access hospital designation would lose that. I would indicate that one of the things that has troubled me from the very beginning of this conversation about the mileage restrictions is you can have two critical access hospitals within 10 miles, 25 miles, 20 miles, whatever that number is, within both of them then are affected by the change, and you lose the designation for both hospitals to be a critical access hospital, which very well may eliminate access any place within that region. And so this being perspective, this be taking into account the consequences to two hospitals in the same radius, I think this needs to be receive greater thought than just a strict mileage requirement.
Well, and again, we would be happy to work with you on that issue, because that certainly is not the intent to, as you say, it applied you know, arbitrarily. What you described could happen, but we will be glad to work with you on that.
I welcome that. The other topic I wanted to raise was NIH funding, and the President's budget is a continuation of the current levels of funding. Budgeting is about priorities, and I understood from your testimony, but from the conversation that you had with Senator Shelby, NIH indicates that, or at least the administration indicates that through new grant management policies, more can be done with less, I think, is the summary of what's being suggested. But I noticed that, for example, the CMS budget goes up $1 billion, while the budget for NIH is held constant. And if there are more bang with the buck, more able to do more with less, I wonder why that's not applicable elsewhere, and why it seems to be directed toward NIH. I worry when there is not a consistent availability of money at NIH that we begin to lose the infrastructure, the commitment of young people to research and to science, to wanting to pursue that career, and know that they have a place to go to work. I think NIH is critical in our global competitiveness and ultimately in saving healthcare costs. The chairman talks about preventive medicine. NIH has a significant component to play in finding the cures and treatments that in the long run save dollars. So in that sense, for the quality of life and for the economics, NIH is something that is very important. And while other items within your budget received increases, NIH did not. And those priorities, I would welcome your thoughts on that. Before I run out of time 37 seconds ago, I have invited the acting administrator of CMS to Kansas, and I would ask you to help me accomplish that goal. Since I've been in Congress now for 15 years, I've invited every CMS administrator to come to our state. Over the years, two have accepted that invitation, and I certainly would welcome the opportunity to have Ms. Tavner with us in Kansas and get a feel for how we deliver health care in our state and to meet with providers and patients. And if you can encourage your acting CMS administrator to join your senator in your home state, I would appreciate that very much.
I will certainly follow up on that with Marilyn. I know she's eager to get out and about and around the country, so I didn't know that invitation was pending. Let me just, if I can, Mr. Chairman, briefly address the NIH situation, which we share this priority. I would say that the requests for the new resources at CMS are one, due to the growing needs in both the Medicare program with the baby boomers coming in. There are about $200 million dedicated to Medicare and Medicaid issues, and the $800 million is, again, basically a one-time cost for infrastructure. I do think the NIH budget with the new opportunity for clinical and translational science awards, which has an additional budget allocation with Dr. Collins able to allocate just under an 8% increase in new grants, about 670 new grants. We are trying to drive the resources toward just what you've described, which is the most strategic way to keep not only young people involved and engaged, but keep the acceleration of promising breakthroughs on the horizon. And he feels that this is a budget that does accomplish those goals.
Thank you, Madam Secretary. I'll submit a question to you in writing related to Part D preferred network plans. If you could respond to the committee, have the department respond to the committee, I'd appreciate it.
Sure.
Thank you, Mr. Chairman.